say men should be involved in antenatal care,
Okay.
so that they will understand and know that these women really need them, even during delivery and even after delivery. Because most men after delivery, they'll just like, she don't born. Let me use that word.
They leave their wife. They don't care anymore.
Exactly.
They feel that the thing has been given to them. There's no need to care for the woman.
Let me say, take for instance, you see a woman that did CS. All of a sudden, you see the woman doing house chores. Every woman that undergoes delivery needs a total...
Hello viewers, how are you? So today we have a guest in the house. The one and only midwife. Her name is Nurse Sandra. That's what we call her. So you're welcome, Nurse Sandra, to tatafo.com.
Thank you.
All right. So Nurse Sandra is experienced in midwifery. So Nurse Sandra, can you just tell us a little bit about yourself? Just 1 minute.
Okay. Nurse Sandra, as usually called, I'm a midwife, and this is my 10 years in practice.
Wow, 10 years as a midwife.
As a midwife.
Wow.
So nothing much. Is a job, is a profession that I love so much. You know, when I was 6, I had a kind of accident and I was taken to the hospital. I saw the nurses in white and I so much loved the way they took care of me. This hand, this was one of the reasons that made me to join nursing. This hand was like this because I dipped the hand into groundnut oil and the hand became like this, and the care they gave me was so massive, and that was where I picked my interest of being a nurse.
Wow, did you hear that? So assuming the nurses on duty were not doing their job, I don't think she would have been motivated to be a nurse, right?
Exactly.
So that means wherever you are, do what is right, because you may be motivating somebody. So today, nurse, I want to ask you something.
Okay.
I used to hear of mental health of women, like after they've given birth, that some people don't go, they are not well. I don't know, as if, so I don't want to use the word mad, like they're running crazy and all of that. Is it true? What is that all about?
Yeah, actually it's true, but we won't call it madness. It's called puerperal psychosis. That's
Puerperal psychosis.
Yeah, or
okay.
postpartum psychosis. It occurs to most women.
Like,
no,
okay, out
all.
of 10 women, for instance, like how many?
Out of 10, let's say maybe like 3.
Okay, so let's say 30% of
yes,
women.
30% of women
Okay.
Drops down with such kind of condition.
Okay.
And this postpartum psychosis is a mental health emergency. Once it's been, noticed or detected, please, wherever you are, you rush down to the hospital, because most of the time it usually occurs within 2 weeks to 12 weeks after delivery. Do you understand? So this postpartum psychosis, we can't really tell the actual cause, but
So
sometimes...
can I ask a question? What are the indications of this illness in a woman? Okay. Can we call it an illness?
Yes, it's an illness.
So how can a woman who just gave birth, how can we detect, like, okay, this is a sign of this? How do we know that?
Okay. At first, they start with a kind of anxiety. They start with anxiety. There's this fear that comes into them just like that. Either the fear of, oh, my child, is this child going to survive, or am I okay? Do you understand? And then from the anxiety, you see them, they start hallucinating. They start thinking about things that are not real. And at the same point, they go into delusion. Before you know it, they'll start like seeing things that are not normal. Do you understand? And most of the times, it's good during your antenatal. When they say history, some people feel the nurses or the doctors just like asking questions. We keep all these things for record. It's possible there are mental cases in the family, because sometimes if mental illness runs in the family, it can actually lead to that during postpartum care. Do you understand? And that is why even after delivery, you watch most hospitals, they won't want you to go. They'll keep you for like 6 to 12 hours.
Is that the reason they do that?
Yes, that's one of the reasons they do that.
Okay.
So that they will monitor you and ensure that every other thing is stable, apart from your blood level and all those stuffs. So most times it runs in the gene. It's genetic. Why most times it's being caused by depression. Do you understand?
Depression.
Like, yes.
Okay.
Why I said it's being caused by depression. For instance, we know the economy is very bad. Do you get? And then you see most women that are pregnant. due to what they are passing through, they now start over-laboring themselves, thereby affecting their mental health, too much thinking, too much stress. And you know you are pregnant, you are not the only one, you are carrying another fetus inside of you. So by the time you pass through all this stress, and then maybe during labor, you also pass through some
labor stress
maybe prolonged labor or obstructed labor, you know, or maternal distress. It could be anything. And at the end of the day, after the delivery, within 2 weeks, you start seeing some kind of funny signs. And at this point, that is why we always say men should be involved in antenatal care,
okay,
so that they will understand and know that these women really need them, even during delivery and even after delivery. Because most men, after delivery, they'll just like, she don't born. Let me use that word.
They leave their wife. They don't care anymore.
Exactly.
They feel that the thing has been given to them. There's no
Good.
need to care for the woman.
Let me say, take for instance, you see a woman that did CS. All of a sudden, you see the woman doing house chores.
So you were talking about CS, that you see some women after delivery that they begin to do a lot of chores, and you said that's not good. So
it's not good.
Why is it not good?
Okay. Being it CS or normal spontaneous vaginal delivery, the woman needs care after delivery. The woman needs care after delivery because of the stress, you know, she must have passed through. Now, you can imagine, like I said, men should be involved in antenatal processes so that they will also be taught on how to guide their wives after delivery. Now, why did I say that? You know, the stress, the pain they have gone through already, they are not out from it. And you expect these women to start doing house chores, to start catering for the family. Breastfeeding alone is another job on its own. Do you understand? So by the time they keep doing all these things, stressing out themselves, it starts affecting their mental health. They start getting depressed. They start being stressed. Thereby, sometimes it can even lead to mood swing. All of a sudden, you just see a woman that is happy, all of a sudden she's no longer happy.
Wow.
Or they start feeling there's this anxiety, this fear. Or maybe the husband no longer shows them the kind of love that he usually shows them. All these things affect their mental health.
So what can you say can be done to prevent postpartum, some people call it postpartum depression, right?
Yes.
What can be done? Can you just tell us quickly what can be done to prevent this?
Okay. First of all, like I said, during your antenatal visits, if you have such traces in your family, ensure you tell the doctor.
So let me ask, are you saying that this happens to only those that have traces of mental health in their family?
No, but at least that's the first step.
Okay.
That's number one.
Okay.
Number two, there's what one of my doctors used to call TLC. Tender love. Good. Tender loving care.
Okay.
The tender loving care you give to a pregnant woman, even during pregnancy and after delivery, goes a very long way. It helps them not to fall into depression. It helps them not to fall into anxiety. It helps them not to fall into mood swing. So after delivery, they need all these things in order to make them come back to their self.
Okay.
Because at this point, there are different hormones that are already in place at this moment.
Okay.
And you know, most of them have lost blood, and they have passed through stress. So they don't really need anything that will, you know, make them to start thinking worthless of themselves. Just like some men after delivery, they'll just, madam, I'm coming, you leave your wife and go. And you expect this same woman that have suffered for you to be the one doing all those things. No, they need family members around that will cheer them up. And that is why I like the Igbo people that usually go for Omogo. Most people think Omogo is just for the mothers to just go, you know, stay 2 months, 3 months, and then they come back with maybe clothes, food stuff. No. That period that the mothers are with their daughters, they show them love. They make them to understand that you are loved by us. You are loved by your family. You are loved by people around you. Even if the husband is not there, at least there's somebody else to talk to her, you know, to cheer
help
her,
out,
to help her out. Yes,
chairs.
because these mood swings come naturally after delivery. It comes naturally.
So in other words, care is very important.
Very, very important.
Attention and love to the woman.
Yes.
Especially if you have started loving the woman when she's pregnant. Also extend that love when she gives birth. Because for some people, I think, from what you're saying is, when they've given birth, they now begin to feel, oh, so I've given you what you want now. I no longer matter.
Exactly.
So it is important for a husband to actually show that love.
them, yes.
Family members around to show love. And that way it will reduce postpartum depression. Thank you so much, Nurse Sandra. Of course, we're in Nigeria. Nepa has taken the light. So we're going to end this interview here. It is nice having you. So we hope you're going to come back again some other time. Thank you. Thank you for coming to our show.